Is my tendon pain a tendonitis or a tendinosis? Why should I care which one it is? I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and knowing if you're suffering with a tendonitis or tendinosis is a really important thing to know. The reason why is that the healing for both of them is very, very different. So a tendonitis is an acute inflammation. Usually it'll be an area where you'll feel some warmth, you may see some redness over that area. It has all the hallmarks of an inflammatory process. This is often caused by a sudden injury, but can be caused by repetitive stress. Therefore, the treatment for this is what you would do for a regular inflammation. You want to ice the area, you want to rest it for about a day or two, then you want to get back to pain-free movement, to tolerance. Don't overdo it. Now, a tendinosis is different. This is a chronic degradation of the tendon due to overuse or sometimes aging without any inflammatory response. You see, what happens is the tendon initially goes through a tendonitis phase. However, if the body's not able to heal the tendonitis, it will actually start ignoring that area and it will turn into a tendinosis, which means you have a decreased blood supply to that tendon. If you have less blood supply than normal to that tendon, that means you're not going to be getting that healing response because, of course, the blood flow brings the nutrients into that area so it can heal. So if you put ice on a tendinosis, it's going to help because it's going to make the pain decrease, but it's not going to help the long-term issue. It's not actually going to improve the tendinosis. So in the clinic, when I'm treating a tendinosis, I am actually going to be trying to bring blood flow to that area to get the body to respond to that area again so that it can actually heal. There's lots of different ways that we can do this through manual therapy and different manual therapy techniques, including soft tissue mobilization or even joint mobilization to put the appropriate amount of stress on that tendon. And one of my favorite new tools for it is to use shockwave. That's a specific machine that puts a pressure wave into that tendon to stimulate the healing and improve the blood flow. And let me tell you, it is way less painful than having me dig on you for a long time. So if it's a tendonitis or it's a tendinosis, it's important to know the difference so that you know what the next best steps are for your treatment.